Good day, everyone. My name is Gerald Ababa Bisara, and today I am going to perform the obtaining vital signs. Accurate measurement of vital signs is essential because it reflects the body's basic functioning and provides baseline data that enables us to track changes in a patient's condition, identify early patient deterioration, and prevent potential harm or errors. Temperature, pulse, respiration rate, and blood pressure are the examples of vital signs. So, the necessary equipment is a digital auxiliary or thermometer for measuring the patient's body temperature, a stethoscope, and a sphygmomanometer or measuring the patient's blood pressure, a watch with a whip second hand for measuring the patient's pulse rate and respiration rate, and alcohol for disinfection and to prevent contamination. Now, I am going to begin by taking my patient's body temperature. The temperature is crucial because it represents the body equilibrium between the heat production and the heat loss. And there are few locations where we can measure it, including the oral, temporal, rectal, axillary, and tympanic membranes. But for today, I am going to take my patient's body temperature through her axillary sites. So prior to the conduct of the procedure, I am going to close the door to ensure my patient's privacy. Next is I am going to adjust the light and adjust the room temperature to ensure my patient's comfort. Next is to perform hand hygiene to disinfect our hands and of course to avoid contamination. Okay, so now I am going to introduce myself to my patient and verify her identity and of course explain to her the procedure that I'm about to do. So hi ma'am, good morning. My name is Gerald Bisara and I'm your student nurse for today. So ma'am, I will going to take your body temperature using your armpits or your axillary side. So is that okay with you ma'am? Yes. Okay ma'am, so may I see your hands please? Ma'am, what is your name? Aya Alba. Okay, Ma'am Aya. What is your birthday, ma'am? November 16, 2003. Okay, thank you, ma'am. So, ma'am, I'm going to pull up your sleeves to put the thermometer under your armpits. Okay. So before I'm going to place it in the area, I have first to take a look and see if there are any scars or lesions and pat dry the area if wet or moist. So, ma'am, can you please raise your hands? So cross here. So after putting the thermometer, now we're just going to have to wait for a minute or up until the thermometer beeps, which indicates that it has already obtained the body temperature of the patient. When the temperature beeps, I will have to inform the patient of the result of her temperature and of course disinfect the thermometer and perform hand hygiene and document the data that I have gathered. So let's wait for the thermometer to beep. Okay. Thank you, ma'am. Thank you, ma'am. So your temperature is 36.4 Celsius, which is within normal range. So let's disinfect. Now I'm going to disinfect the thermometer that I have just used, then perform hand hygiene and I will document the data in the TPR sheet of the patient. After getting the temperature of the client, now I am going to proceed in taking my patient's pulse rate. The pulse is a wave of the blood created by the contraction of the left ventricles of the heart, and in order for me to measure it, I am going to need to do palpation on the both sides of the patients, which could be through her temporal, carotid, ethical, brachial, radial, femoral, amplitude, tibial, and her versalis pedis. But today, I am going to be palpating her radial pulse because it is the easiest and the most accessible pulse size. So prior to the conduct of the procedure, I'm going to need to do the first four pre-introductory steps, which are to close the door to ensure the patient's privacy. Next is to adjust or to provide adequate lighting to ensure the patient's comfort. And lastly, to perform hand hygiene to disinfect our hands and also to avoid contamination. We don't forget to introduce our name to our patient and to introduce the procedure that we are going to do. Hi, ma'am. My name is Gerald Ababa Bisara, ma'am, your student nurse for today. So, ma'am, I am going to get your pulse rate. Is that okay with you? Yes. Okay, ma'am. So, ma'am, can you see your wrist? Okay, ma'am. Ma'am, can you please state your name? Aya Alba. Okay, ma'am Aya. Can you please state your birthday? November 16, 2002. Okay, thank you. So now I am going to assess of your pulse rate, ma'am. So can you please give me your hand? Okay, can you? So now to locate the radial artery or for the radial pulse, I'm gonna need to use this two fingers of my hands, and I won't be using my thumb because the thumb actually has a pulse in it. So I'll just have to trace her thumb and place my fingers in the area of her wrist and feel for the pulse. And it is important to know that aside from the number of beats per minute to count, I also need to check for the strength of her pulse, which is braided on 0 to 3 plus scale. 0 is being the pulse is absent, 1 if it is weak, 2 for it is normal, and 3 plus if it is bounding. And of course, I also need to check if its rhythm. I also need to check the rhythm if it's regular or irregular. Okay, ma'am. So now that, okay, ma'am? Okay. Okay. Okay, ma'am. So now that I have found the radial pulse, I am going to start counting beats per minute. So I have obtained my patient's pulse rate. So this is your pulse, radial pulse, ma'am. Okay. Ma'am, your pulse rate is 76 beats per minute. It is graded 2 plus, which means it is normal and it has a regular rhythm. So after doing the procedure or after taking my patient's pulse rate, and now I am going to have to do a hand hygiene and of course document the data that I have gathered in her TPR sheets. 76 beats per minute, normal. after that, now I'm going to be measuring my patient's respiration rate. So the respiration rate is simply the number of breathing of a person takes in a 1 minute. And it's usually done when the person is at rest and by just simply counting the number of rising of the chest of the patient. So prior to the conduct of the procedure, I am going to do the 4 pre-introductory step, which is to ensure the patient's security and privacy, and provide comfort and perform hand hygiene, and of course, introduce myself to the patient and verify her identity and tell her what the procedure will be all about. So, good morning, ma'am. I am Gerald Ababa Bisera, ma'am. So, today, ma'am, I will going to be checking your respiration rate. So, is that okay with you?
Yes.
Okay, ma'am. So, first, ma'am, can you show your wristband? Okay, ma'am. Can you please state your name?
Aya Alba.
Okay, ma'am, your birthday?
November 16, 2000.
Okay, ma'am. Thank you. So, okay, thank you, ma'am. So, today, I'm going to be counting your respiration rate. So, I just need you to be relaxed or at ease, okay? So, for counting the respiration rate, I'm not only simply counting for the number of breaths she takes, but also for the depth of her breathing. If it is labored or unlabored, and for the rhythm, if it is regular or irregular, and for the character of course, and it is important to know that one rise and one fall of the chest would be equivalent to one respiration rate. Okay, so here, just relax, ma'am. Okay, ma'am? Breathe. Okay. So, ma'am, your respiration rate is 16 breaths per minute, which is within normal. So, it is within the normal range. So, and it is a regular rhythm and a labor. So after doing the procedure, I then need to do the hand hygiene and, of course, document the pulse rate and respiratory rate and her TPR sheet. So now I am going to be measuring for her fourth vital sign, which is the blood pressure. So the blood pressure is the pressure of the circulating blood against the wall of the arteries. And it could be obtained with the use of the stethoscope or the sphygmomanometer. So prior to the procedure, I have to do the pre-introductory steps, which are to ensure my patient's privacy, to provide comfort, to do hand hygiene, and to introduce myself to the patient, and to tell her about the procedure that we will be doing. So good day, ma'am. My name is Gerald Ababa Bisera, ma'am. Your student nurse for today. So ma'am, I will be checking your blood pressure. Is that okay with you?
Yes.
Okay, ma'am. So ma'am, can you please show me your wrist? Okay, ma'am, can you please state your name?
Aya Alba.
Okay, ma'am Aya, can you please state your birthday?
November 16, 2000.
Okay, thank you, ma'am. So prior the conduct of the procedure, I have already checked for my equipment. if they are clean and if they are well functioning. I also have the correct size of the cuff that I'm gonna be need for my patient, and of course inspected my patient if she has any injuries, cast bandages, interview intravenous infusions, blood transfusions, or any arteriovenous fistula which could be hinder me from picking or taking her blood pressure in a particular limb. So since that the patient is sitting, I'm gonna need to make sure that both of her feet area on the ground, because the blood pressure increases if the legs are closed, and I'm gonna have to place her arm at the heart level, because if the arm is at the lower level, then it would give us the higher blood pressure reading, and if the arm is at higher level, then the heart, it would give us the low blood pressure reading. So, amen. Okay. So since that this is the initial examination of my patient, I'm gonna have to do the preliminary palpatory determination of her systolic pressure to avoid having a lower systolic reading by oscillatory method if there is an oscillatory gap. And to do that, I am first gonna need to place the top of her arm just about 1 to 2 centimeters above the antecubical space, and palpitate for her brachial artery through the use of my 2 fingers. Once I have found the brachial artery, I'm gonna start inflating the cuff, and I have no longer feel the pulse of her brachial artery. So now I'm gonna deflate the cuff, and I have already taken her estimated systolic pressure, which is 140 millimeters of mercury. So for the actual taking of her blood pressure, I'm gonna need to inflate the cuff about 30 millimeters of mercury higher than the estimated systolic pressure. This is to ensure or to avoid missing of the auscultatory gap, which is the temporary disappearance of the corrupt sound while deflating the cuff. So for the actual procedure, I'm now gonna need to use my stethoscope. But first, I'm gonna need to disinfect the earpiece and the diaphragm and the bell of the microscope. So for the third, I'm gonna have to use the bell part of the stethoscope, because the bell is best used for hearing low pitch sound. So once I have found the brachial artery, I'm gonna need to inflate the cup 140 millimeter of mercury. So now I'm gonna fully plate the cup, and the first sound that I will heard would be her systolic pressure. And for the diastolic number, it would be the period of silence after the last sound that I have heard. So since this is my patient's initial examination, I'm gonna need to do the procedure again of her this arm. So, ma'am, your blood pressure is 120 over 70 millimeter of mercury, ma'am. So, next is we need to disinfect the stethoscope to avoid contamination. After that is to disinfect our hands to avoid contamination. Next, after that, we should put the result into the client's TPR sheet. (120 over 70 millimeter over millimeter mercury). Thank you so much, ma'am. And thank you so much for watching. That's the end of my return demonstration.